Hi, my name is JP. I'm a student physical therapist assistant from CBD College, and today I'll be discussing Mr. Jenkins' case. Mr. Jenkins is a 74-year-old patient who has chronic osteoarthritis on his right hip and recently just underwent right total hip arthroplasty. He is now being treated for physical therapy in patient setting. Patient was independent with ambulation using a cane prior to surgery. Patient has history of early dementia, COPD, and atrial fibrillation. This might affect the patient's response to treatment as to difficulty following commands, constant vital signs monitoring, fair activity tolerance due to easy fatigability. Patient's progression to minimal protection phase may be slightly delayed considering the patient's response to treatment due to said conditions. At this time, stretching the patient's hip extensors is inappropriate as patient is not allowed to flex the hip more than 90 degrees as part of dislocation precautions post-THR. There should be no resistant exercises for internal rotation and adductors at this time to comply with the precautions and due to the patient's pain and weakness. Due to the patient's history of atrial fibrillation and is currently on medication, it is best to closely monitor the patient's heart rate and the rate of perceived exertion before, during, and after treatment, as there may be irregularities and adverse reaction during exercises. It is best to monitor the patient's compliance to weight bearing and hip dislocation precautions, considering the patient's early dementia, which affects his ability to follow commands and remember them. After today's physical therapy treatment, the information that is significant to report to my supervising physical therapist is how the patient tolerated the treatment today, any adverse response, and how the patient improved with functional mobility levels such as bed mobility, transfers, and gait.